Assalamu alaikum. Hello dear residents. I prepared this presentation for you to give you an idea what OSCE station might come in the exam. And each OSCE station, there is an example how to approach the OSCE station and how to be confident throughout your station. Just go through the scheme that I prepared and I'm sure you'll do fine. You just need lots of practice before your exam date. So before entering the exam, make sure that you are confident, safe and organized. First of all, I would like to give you examples of what OSCE station that might come in the exam. You might have a teaching station where you teach a procedure to a resident, or even a procedure that you have to teach to a mother or another colleague. Reading, you might be given like an X-ray, an ECG, any lab result that you have to know how to read it and explain how to read this result. An ER station, which is basically what we do in our PALS. Structural oral, or what we used to call card. This is where you start answering the station, and then at the end of the station, the examiner might give you clues and answers. Communication station, it's also like to communicate with the parents, to explain any kind of diagnosis or even breaking bad news. Examination, you should be ready. Any part of the body system you need to examine, including the musculoskeletal and the central nervous system. Medical error, how to approach a medical error, how to counsel the parents if there is any medical error that occurred in the ward or even in an ER situation. A phone call station, this is very common. Also, you might enter an exam and there is only a phone where you have to answer it and communicate with another colleague. He may be far away from your hospital and you need to start the management or even counseling through a phone call. And last but not least, we have the adolescent station. How do you approach an adolescent? How to take a full adolescent history. We will start with teaching. This is basically to teach any kind of procedure. You should be prepared to teach any procedure that you have done in the ward. So I'm sure it will be easy. It's something that you do every day. For example, here we have an example. There is an R1 resident. This is what we call the STEM. You read it before entering the station. You usually have 2 to 3 minutes outside the stations where you can read the STEM and organize your thoughts. R1 resident saw the ER team placing an intraosseous for one emergency case in the ER the previous shift. He was very interested about the procedure. Teach an R1 resident how to insert an IO. And then after teaching the procedure, you might have to answer post-encounter questions. Okay. So this is just an example. For example, after you finish teaching the procedure, I just listed some example of questions that you might be asked during the station. For example, list 3 insertion sites for the intraosseous, when to insert it, how long can you keep it in place? If you are unable to aspirate any fluid, does that mean that you cannot flush any IV fluids or medication through it? And how many intraosseous can you insert at what time in an emergency situation? So when you start a teaching station, this is a very important slide. This is the scheme of how to start your teaching station and what we call the body, and how you answer all the questions in the middle of the station, and how to conclude. So first of all, don't forget to greet yourself. Always greet and introduce yourself. I am Dr. Farah, for example, and I am the senior pediatrician covering the ER station. Try to break the ice. Any sentence, just how are you doing? If he is an R1 resident, how are you liking the residency program so far? And then make sure that you ask the resident or the trainee, whatever the question was stated, have you seen it before? You have to ask this question at the beginning, just to have an idea. The resident, if he has any idea, is it totally new, or have he seen it before? Have he tried it? So you have to ask, have you seen it before? And then make sure you have to mention to the resident, please interrupt me at any time if you need me to repeat myself, and make sure that you are slow and clear when explaining the procedure. And then you have to list the steps for the procedure. Make sure you mention to the resident that first of all we need a consent to be taken, but this step you can skip it if it's an ER station. You don't need to mention the consent form. If it's not an ER procedure, you have to mention that first of all, before starting the procedure, you have to take a full written signed consent from the parents. And then you have to list the contraindications. So in our case, the intraosseous, you have to list that it's contraindicated to do it if the child suffers from any skeletal deformities, such as osteogenesis imperfecta, if he suffers from any bleeding tendency, such as hemophilia. And then when you are finished from the contraindication, you list the indications. So when do we need it? You need it if there is difficulty inserting an IV cannula in an emergency situation. And then you mention the complications. So as any procedure, you can have bleeding, infections. Specifically for IO, you should look out for compartment syndrome, embolisms. And then you would mention the equipment. So what do you need? In our procedure, for example, you would need a large drill, a large screw, needle. You have to mention exactly what equipment do you need. After the equipment, you go through the procedure. You should be familiar with the procedure and how do you start it. To hold the bone well, just make sure it doesn't slip. Make sure you don't puncture the needle through your hands to avoid any injuries. Just walk throughout the procedure and then mention that throughout the procedure the patient should be under monitoring, and don't forget at the end to document in the file. When you are finished with these steps, just make sure that you mention for the resident, now you see it, next time you will do it, and then you will teach it. And to conclude the procedure teaching OSCE station, always leave the resident with a topic to prepare next time for other residents. So for example, in our station, you can leave them with any simple topics. For example, you can mention that, okay, next time, I would like you to prepare a presentation, just reviewing the contraindication, indications, and complication of intraosseous. So for here, I just mentioned an example, and these are the answers of what I just mentioned. And then, as I mentioned, the examiner might ask you post-encounter questions. So just make sure you are ready for any questions and just answer them smoothly. And this is the end of our procedure teaching station.